Hi, today we're discussing a classic case of running-related knee pain. Our patient is a 28-year-old recreational runner experiencing burning pain on the outer side of their knee during and after long-distance runs. The pain resolves with rest but returns predictably with running activity. This presentation will walk through our diagnostic reasoning, contributing factors, and comprehensive management plan. Diagnosis: iliotibial band syndrome. The patient's symptoms are classic for iliotibial band syndrome, or ITBS. This is an overuse injury where the iliotibial band rubs against the bony prominence on the outside of the knee. Key indicators include localized pain about 2 finger widths above the knee joint, pain that typically begins after a certain running distance, and the characteristic burning quality. The timing is crucial. The pain coincides with increased training intensity and a switch to running on asphalt surfaces. Ruling out other conditions, we considered several other potential causes but found ITBS most likely. A meniscal tear was unlikely due to the absence of trauma or mechanical symptoms like locking. LCL sprain was ruled out as there was no specific injury event. Patellofemoral pain was less likely because the pain isn't around the kneecap and isn't aggravated by stairs or sitting. The specific location and running-related pattern pointed strongly to ITBS. Training errors: the primary trigger. The onset was triggered by 2 key training errors. First, a rapid increase in training intensity, the classic, too much, too soon, approach that overloads the tissue's capacity to adapt. Second, transitioning to running on hard asphalt surfaces, which increases impact forces transmitted up the leg. Additionally, running on slanted roads created pelvic tilting that placed extra stress on the IT band. These changes without proper progression overwhelmed the tissues. Underlying biomechanical factors. Beyond the immediate triggers, several underlying factors predisposed this runner to ITBS. Weak hip abductors, particularly the gluteus medius, allow the thigh to collapse inward during running, increasing tension on the IT band. Tightness in the IT band and related muscles reduces smooth gliding over the knee. Core muscle fatigue during long runs can also contribute to form breakdown and increased stress on the knee. Phase 1 Acute Management. Our management begins with acute phase strategies. We implement relative rest, reducing or eliminating running while maintaining fitness through swimming or cycling. We use ice therapy to control pain and inflammation. Soft tissue work focuses on the hip and thigh muscles rather than the inflamed knee area itself. The goal is to calm the irritation while maintaining overall fitness. Phase 2 Rehabilitation. The rehabilitation phase addresses root causes. We strengthen hip abductors through exercises like clamshells and side-lying leg raises. Core stability work includes planks and bird dog exercises. We improve flexibility in the hips and thighs. Gait retraining focuses on increasing step rate to reduce stress on the IT band. This phase is critical for preventing recurrence. Phase 3 Return to running. The final phase involves a gradual return to running using a walk-run program on soft, flat surfaces. We educate the runner on the 10% rule for mileage increases in varying running surfaces. A maintenance strength program continues 2 to 3 times weekly. The key is progressive loading that allows tissues to adapt without re-aggravation. In conclusion, this case demonstrates how training errors combined with biomechanical factors lead to ITBS. Successful management requires addressing both immediate symptoms and underlying causes through a structured, phased approach. Education on proper training progression and maintenance exercises are essential for long-term prevention. With this comprehensive approach, runners can return to pain-free activity and sustainable training habits. Thank you for your attention. This case highlights the importance of looking beyond just symptoms to understand the full context of an injury for effective management and prevention.